The European Medicines Agency, EEM, Committee for Veterinary Medicinal Products, CVMP, is scheduled to meet February 10th to 12th, 2026. According to the published meeting agenda, pharmacovigilance matters are included for discussion. Librela, Godinvetimab, and Solensia frudevitamab, both monoclonal antibody treatments approved for osteoarthritis pain in dogs and cats, are subject to ongoing post-marketing safety monitoring, as is standard for all authorized veterinary medicines in the EU. In the EU regulatory framework, signal management refers to the formal process used to evaluate potential safety signals identified through adverse event reporting systems and other data sources. The presence of a signal review indicates that data are being assessed. It does not, by itself, establish causation, regulatory breach, or a predetermined outcome. At this stage, the CVMP meeting agenda confirms scheduled discussions. No adopted opinion, restriction, label change, or enforcement action has been publicly issued. Any conclusions or regulatory actions, if adopted, will be reflected in official EEE meeting minutes, published opinions, or updated product information. Pet owners and veterinarians who wish to review primary source documents can consult EMA CVMP meeting agendas and minutes. EMA product information pages for Librela and Solensia. FDA Center for Veterinary Medicine. Adverse event reporting data for U.S. context. As always, pharmacovigilance. Reviews are part of routine regulatory oversight designed to assess benefit-risk balance as new data emerge. Any confirmed regulatory decisions will be publicly documented by the EMA. From a legal regulatory lens, the real interest isn't the meeting itself, it's whether an adopted opinion is issued, whether there is a variation to the marketing authorization, whether product information is amended, or whether the outcome simply states that the current benefit-risk balance remains favorable. These are very different outcomes with very different implications. Most CVMP signal reviews ultimately result in one of three things. 1. No change, monitoring continues. 2. Label update, warning clarification. 3. Formal restriction or referral procedure, less common, until something is formally adopted and published. Everything else is procedural movement. Given my legal background, I'm most interested in the exact wording of the adopted opinion, the risk-benefit language used, whether causality is described as possible, probable, or not established, whether dissenting positions are recorded, if any. That's where the real substance lies.